Okay, so now we're going to talk about acne, part 2. In the first one, part 1, we talked about what causes acne. Now we're going to talk about the different types of acne. So the 3 types of acne that we are going to talk about are comedonal acne. This one's really easy. This is just mild acne that people get every day. All right, and then there's inflammatory acne. And then the last one is going to be nodular cystic or severe acne. Okay, and then just real quick, this is going to be mild acne, this is going to be inflammatory acne, and then this is going to be severe acne. So I'm just going to erase this here. What you're going to need to do is basically rewrite this. I'm only going to write one thing about this. This is basically, it's just mild acne and it's easily treated. And this is the type that goes away on its own also. So it's mild acne and it's easily treated. Remember, TX means treated, okay? So that's comedonal acne. Let's now talk about inflammatory acne. Okay, so in inflammatory acne, usually we talked before about the bacteria that causes acne. So this is usually caused by propionibacterium. This is the name of the bacteria. Okay, propionibacterium acnes is the name of the bacteria. Okay, so that's what this is going to usually be caused by. Okay, and what this does is it uses glycerol for nutrition. And where does it get glycerol from? From sebum. Glycerol is an oil. And if you recall from the last video, we said sebum is the oil that is produced that actually gets on hair and gives you the oil in your hair. So this is it uses glycerol from sebum for nutrition. I guess I could have written food, right? So it's going to use that for nutrition, right? And what this is going to do is this is going to basically cause or lead to the formation of fatty acids. So as I break down sebum, it leads to the formation of fatty acids, of free fatty acids. Okay? So what's going to happen now is we have these fatty acids on the skin. And if you recall, we actually said at the beginning of this chapter that sometimes some bacteria actually like the acidic environment, so it helps them grow. And this is one of them, okay? But at the same time, what it does is it prevents other bacteria from growing in the area. So now you got the fatty acids. That's why skin is actually slightly acidic, is because you're forming fatty acids on it, okay? But the bad thing is, in this case, we're producing too many. So the fatty acids basically cause an inflammatory response. Your immune system doesn't like how acidic the skin is. So the fatty acids cause an inflammatory response. Okay. And if you remember when you guys did the essay at the beginning of the school year, we talked about white blood cells. And what's the white blood cell that usually is the first one to respond when there's an inflammatory response? So in the inflammatory response, I'm going to answer the question. I'm just giving you a second to think. So in the inflammatory response, and if you don't remember, neutrophils. Are attracted to the area, or they come to the area. Okay, does that make sense? So they're going to come to the area, right? But the bad thing is the neutrophils, just like we saw in COVID-19, and just like we see in other things, the neutrophils are going to secrete enzymes that damage the hair follicles. Okay, and the reason this is called inflammatory is because this is what's happening here. This is an inflammatory response. The fact that the neutrophils are involved is inflammatory response. So what's going to happen now is because the neutrophils are secreting these enzymes that damage the hair follicles, what's going to happen now is we are going to get pus and pustules in the area. All right? So the inflammation leads to pus and pustules. And if you remember, a pustule is just basically a pus-filled joint. Right? So how do we treat this? It's treated with antibiotics, because then what we do is if we can fight off the propionibacterium, we don't need the immune response to be as bad. It's treated with antibiotics. And sometimes if you go to the grocery store, you may buy something called benzoyl peroxide. Okay, and what these are going to do is they're going to dry out and unclog the hair follicles. And if I can do that, then I don't have the acne anymore. All right, so it dries out the hair follicles. Okay, that's inflammatory acne. And then the last type of acne we're going to talk about is called nodular cystic acne, which is severe acne. And like the name implies, you get nodules and you get cyst with this. Okay, so it's nodular cystic acne, and this one is severe, okay? So it's characterized by nodules and cyst. Okay. Now the nodules and cysts, they're inflamed lesions with pus that's way under the skin. So the nodules and cyst are caused by pus. Let's put it this way. These are lesions filled with pus. And that are under the skin or deep within the skin. Okay, so because it's underneath, you don't really, well, you see acne, but you also see the cyst. All right, these can leave scars. And nodular cystic acne. Actually, this should have an R right there. Nodular cystic acne. They can leave scars as they heal. Okay, they can scar the skin, and they have a psychological aspect because sometimes kids feel bad about themselves for having acne. There are drugs to treat this, but the thing about the drugs, psychological component, aspect, I'm just going to put aspect because of the amount of time or the amount of space I have over here. All right, there are drugs to treat this. They're very hard on the liver, and they're also very uncomfortable because they dry the skin out so much. And I've actually had students who were on the medication, and they actually had to go for, I think, psychological testing every month because I think there's a suicide component to these drugs. So that's the type of drugs, the type of acne that we have. So part one, we talked about what causes acne. Part two, we talked about the types of acne.